Welcome back to the Marching Health audio experience. Today we're talking about how healthcare and medical providers can have a proper return to play protocol in drum corps and marching arts as a whole. This will be important for members to understand and staff to understand so that we can communicate with one another effectively during a marching season. In the drum corps setting, injuries happen. We know that. So we want to make sure that we are sending members back out after they have healed and making sure that they are safe in doing so. So the big question is, what markers or measurements can we put in place that make sure they're safe, make sure they're healed, and make sure that when they go back out to the field, their chance of re-injury is as low as possible. We call this return to play protocols. I'm a doctor of physical therapy and work in the sports medicine side of the field. This is what we do all the time with our college athletes and high school athletes and even professional athletes. We want to have some measurements. So if you are injured, say you're a member that gets injured and goes out, sitting out and is evaluated by medical personnel, you want to make sure you are looking at this person's range of motion. How is their body moving? How is the joint they're pointing to moving? Is there any loss of range of motion on the injured side compared to the non-injured side? If there is, and this injury is what is causing that loss of range of motion, we've got to make sure that we get that back before we put them back out on the field. And we can get into the specifics of each injury, and we will later on, but that is a big picture thing to look at, a piece of the puzzle that you need to be able to recognize. Also, pain is a big factor. That's obvious. There are, though, a lot of members who want to push through. In the marching arts, there are a lot of tough students out there. They do not want to miss rehearsal. They don't want to miss new information that is being taught to them, because having to learn new drill or new music or changes to the show after sitting out can be one of the most stressful situations you have as a marching performer. So many students will try to push through the pain, and that pain ends up causing them to compensate or move in awkward manners that puts them at risk of either causing that injury to get worse and that tissue to actually become further damaged, or injuring something else. And maybe using, say if the right ankle is what's causing the pain, well maybe they're limping and over biasing the left side and using that too much, and maybe we have an overuse injury of the knee or the hip. And if you're trying to push through some really intense pain and you aren't actually performing well while you're doing that, you might be risking the safety of the people around you. So pain is a big factor in return to play in the marching arts setting. Next, swelling is also a piece of this. Obviously, after we discussed the tissue itself being injured and swelling coming in there, inflammation coming in there, that is actually a marker of healing. A way that you can cause persistent swelling on your own is trying to push through swelling that already exists and be weight bearing. So up on your feet, marching, pounding on the field. That puts a lot of pressure on your joints. And if your joint is swelling up, that is its signal where it's putting its hand up saying, hey, I need a break. I need to calm down. I need to rest. And I need to get this swelling out before trying to push through it. You don't want to be pushing through an injury and causing swelling to get worse. There is something called arthrogenic inhibition. Big words. What that means is, say your knee joint swells. You tweak your knee while you're marching, and now you injured maybe a ligament inside and there's swelling taking place. That joint is sending signals to your brain. Your brain is getting those signals of injury, and your brain is then going to inhibit or shut down your quadriceps muscle. It's going to say, hey quad, we need to heal the knee, so you need to go take a break. I'm going to turn you off so that you can't be working right now. And if you're injured and experiencing that kind of knee swelling as a marcher and pushing through it, well, your quad's not actually working very well, so other things are going to start to compensate for that quad that is getting shut down, and you're trying to override your system. So we want you to make sure you're taking care of swelling and getting it calmed down, whether that's through compression or rest. We want you to solve that problem before getting back out on the field. Strength is also a big piece in return to play. If you have a calf strain, which is one of the most common injuries we dealt with this past summer, if you have a calf strain and you're trying to push through it, but your strength on that injured side is not what it is on the non-injured side, you're going to cause problems. You're either going to make that injury worse or you're going to cause an injury elsewhere. because it's not going to be strong enough to withstand the demands of backwards marching or slides, or for percussion, crabbing. Percussion's always on their toes. So a calf injury can be one of the most frustrating things they have to deal with because their calf is constantly working. There are some tests that we can do once you have passed these basics that allows us to say if you're ready or not. So if an athlete comes to the sideline, say we've got a mellophone player and they've had an injury and they're getting back from it, they've been doing their rehab, their exercises with the athletic trainer of the drum corps, the medical professional on site, they've got full range of motion, their pain is going down, they aren't really having much swelling, and their strength is looking pretty good and pretty close to what the other side is or equal to it. There are some functional movements that we can have them do that are markers that that person's ready to be back on the field fully. We'll talk just lower extremity first. Let's hit lower body because that's where the majority of injuries are. One of those is called the Y balance test. That's where you stand with your feet together. You could even call it first position. And one leg is going to be basically doing single leg squats while the other one reaches in the shape of a letter Y, an upside down Y. So they trace forward, then they trace backward at a diagonal to the outside, then they trace backwards around the injured leg. So it looks like a Y. They hit forwards and then the back two 45-degree angles. Then you have to be able to do that on the other side. And then you compare the two distances reached. The injured side has to be within 90% of the non-injured side. I would even say shoot for 95%. If you're not getting that distance in the reaching, that's a problem. That's an indication that something in the lower extremity is not functioning at the proper amount in order to be able to march well. Single leg squats are another good indicator. Single leg squats and single leg calf raises can be used to isolate certain joints in the lower body. So if it's a knee or hip issue, we want to have them doing single leg squat testing. How many one-legged squats can you do on the non-injured side, and how many can you do on the injured side? We want that number, again, to be within 90% of one another. If there's a major discrepancy, and say you can only do half as many or less, that's a red flag. That person is not ready to get back out there for a full rehearsal yet. Single leg calf raises are a good test for lower leg strength and return to play, say whether it's a calf injury or an ankle issue or even a foot injury. We want to make sure that you can go up onto your toes and come back down and control it, and do that for repetitions. So how many in quantity can we do side to side, right leg versus left leg? After that, once we've got that stationary strength identified, the next level of functional test and return to play test is more dynamic. So it's exercises like a one leg hop. You stand on the non-injured side and hop and land it and test out how far did you do that, and then the injured side has to go. And so on that injured leg, can you jump as far? That's going to test your explosiveness and your power in that leg and your ability to control fast movement. Can you handle the landing properly? Can you land without your knee collapsing in or without causing pain? And can you stick the landing? If you can't stick the landing on that on your injured side, but you can on your non-injured side, that's a problem. We want to make sure you're doing that at a high level and achieving at least 90% of the distance and explosiveness as the non-injured side. That's going to help you in the straight plane. But to test out more of the lateral movements that you need in marching, you need to do a lateral hop test. And you need to set parameters for distance. So there are some physical therapy and athletic training markers that you can look at that are going to give you maybe a foot or a set number of inches or centimeters that you put two marks at, and you have to hop on one leg over those two markers for a set duration of time. And you have to be able to do that with the right leg and the left leg. That's going to give you the indication that this person can handle direction changes throughout a 12-hour rehearsal day. After we've done hop testing and more of those plyometric movements, we want to make sure this person can do marching fundamentals as an individual. That's obvious, right? But you have to really test that out. You can't just have them go march at any given tempo. You got to start slowly, and then you have to have them build up to true show tempos. Someone might be able to pass a test if you said, hey, can you go march? They'll march in front of you, but it might, if it's at 120 beats a minute, but your show's at 208 beats a minute, that's not a good indication if that person's ready to get back or not. And you have to test them marching multiple step sizes in multiple directions. So you test different planes of motion. Also, you need to make sure they can dress to the people around them. So if it's someone, let's take a concussion injury for an example. Their inner ear, their vestibular system, is challenged. And so their ability to take in information from their eyes and have their vestibular system correct any movements around them, that's important. So having the ability to address to people is a big challenge for those who have had a concussion. You also, if you've had any injury, need to make sure you can quickly respond to those around you. That goes back to a previous talk we did on recovery, making sure that you've recovered and have good reaction time. Also, instrument carriage endurance is going to be a piece of improving and clearing someone in the rehab process to be able to get back on the field. If they have an upper body injury, they need to be testing out their instrument carriage. Or if it's a core or low back injury, they have to put their instrument in their hands and hold it. As we transition more into the upper extremity tests, those are pretty similar to the lower body ones, but they're obviously done with weight bearing on your arms. So you can do a Y balance upper extremity test where you get basically in a push-up position, and with one hand at a time you trace out a forward motion, a down and back motion, and an out and back motion. And you have to compare side to side. Can you reach the same distance? You do the same things that we would do for the lower body for the upper body. So an instrument carriage test is going to test out the endurance in the rotator cuff or in the upper back if you've had an upper back issue. We want to make sure that you, students, staff, and healthcare providers are equipped with information to send people back to the field safely. So if you want to leave a comment or message us privately asking what are some other ways you can test these things or what other documents that we may have to be able to put members through a rigorous return to play testing, please let us know. We want you to have a safe summer, and more importantly, we want you to have fun.